Beta blockers are used for the prophylaxis of angina. The choice of drug may be important. Intrinsic activity might be a disadvantage in angina, and the cardioselective beta blockers, such as propranolol, bisoprolol, and metoprolol, are probably the drugs of choice. Let us talk about mechanism of action of beta blockers. Overall, propranolol reduces myocardial oxygen consumption for a given degree of physical activity. Arterial blood pressure, afterload, is also reduced by propranolol. Although the mechanisms responsible for this antihypertensive effect are not completely understood, they are thought to involve a reduction in cardiac output, a decrease in plasma renin activity, an action in the central nervous system, and a resetting of the baroreceptors. Thus, propranolol may exert a part of its beneficial effects in secondary angina by decreasing 3 of the major determinants of myocardial oxygen demand, that is, heart rate, contractility, and systolic wall tension. Propranolol and other beta blockers also have been shown to produce an increase in oxygen supply to the subendocardium of ischemic areas. The mechanism responsible for this effect is most likely related to the ability of beta blockers to reduce resting heart rate and increase diastolic perfusion time. Because subendocardial blood flow and flow distal to severe coronary artery stenosis occur primarily during diastole, this increase in diastolic perfusion time, due to the bradycardiac effect of propranolol and other beta blockers, would be expected to increase subendocardial blood flow to ischemic regions. Beta blockers have no significant effect on coronary collateral blood flow. Finally, there is evidence that beta blockers can inhibit platelet aggregation. Let us discuss adverse effects of propranolol. Abrupt interruption of propranolol therapy in individuals with angina pectoris has been associated with reappearance of angina, acute myocardial infarction, or death due to a sudden increase in sympathetic nervous system tone to the heart. The mechanisms underlying these reactions are unknown, but they may be the result of an increase in the number of beta receptors that occur following chronic Beta-Adrenoceptor blockade, upregulation of receptors. When it is advisable to discontinue propranolol administration, such as before coronary bypass surgery, the dosage should be tapered over 2 to 3 days. All beta blockers must be avoided in asthmatics as they may precipitate bronchospasm.